Good morning, Dr. Shannon Smith. Wanted to reach out and try to periodically do just some quick maybe some case reviews or some interesting things that I see during the week. So I had this really interesting case, and a lot of them are, Lyme disease patients that have their reoccurring symptoms, and you feel that it's, the infection came back, and I need my antibiotics again. I can't get back to that. I don't want to go back to that same place that I was in my life. But really what it is a different vector as opposed to the infection reactivating, but a different vector that's turning back on that signaling, what we call cell danger signaling, to say, oh my gosh, these are my symptoms again. And the challenging part is trying to find out what the actual vector is, as opposed to just certainly throwing you back on antibiotics to say these are better for my symptoms. I had a case the other day that the vector was some hormonal dysregulation from a young female that really was turning back on that immune response. And so after we looked at labs, the labs looked fine, her immune system looked fine. The specific labs that we can do are a lot different than a lot of providers. So we can kind of see if that's turned back on or not from an infection standpoint or from another vector standpoint. So when the labs look really good, there's obviously something that we're missing or something different. So I did not run hormonal labs. So once we reran the hormonal labs, you could see that there was a hormonal shift. She did go on some HRT, and it made a world of difference. And so all of her Lyme symptoms went away. Now we're just working with the PTSD part, the psychological part of the fear of having her symptoms come back. So I thought it was a really interesting case. Her diet was perfect. Supplements were fine, her vitamin D levels were fine, nothing else was going on, but her symptoms came back, in a huge way. So for those of you that are having, reoccurring symptoms, they're coming and going, or just kind of hit you like a ton of bricks, it's not always the infection, it's the immune system that we have to work on. So hope that helps. I'll try and do some updates periodically.